On today's edition of Steps to Success in Medical Assisting, we're going to talk about medical files. I'm Lindsay Wolf, and I'll be taking my certification exam soon, so knowing what's what with medical files is important. To begin with, I've learned that these are legal documents, so forget the smiley faces on favorite patient files. I've also learned that one of the first things you should learn is the office filing system. Let's take a look at a crisis at Riverside Medical Practice.
That's funny. Karen Adams' file isn't here.
Did you check the exam room? Maybe you left it in the door and just forgot it.
No, I've looked there. I know it was right on the counter when I pulled the records last night. I'll check the file drawer. Maybe somebody put it away. It's not here.
Look under K's. Maybe somebody misfiled it under her first name.
It's just not here.
All right, well, don't panic. Do you remember what she was coming in for?
I think a blood test.
Do you remember if she had to see the doctor?
Not until after the blood test. And some of it will have to be sent out.
Okay, you're safe.
What do you mean if safe? We've lost this woman's whole medical file.
So you'll recreate it.
Rita sounds nonchalant about it, but there's a lot that goes into a patient's medical record. Here's a typical list of the contents of a standard medical record. There's the patient's past medical history and a history of the present illness, whatever brought Karen Adams in for a blood test, and her chief complaint, sometimes called the CC. Then there's the assessment of body systems from her annual checkup, progress notes from past illnesses, her family medical history, her personal history, the history of her medications and refill orders, treatments, X-ray and MRI reports, lab test results, consultation reports from other doctors, diagnosis, insurance information, and her signature that allows release of her medical information to others. It'll be very difficult to duplicate all of this information, and since it is a legal document, you'll also have to note that it is duplicated.
Come in.
Before I draw some of your blood, I need you to sign a consent form.
What's going on? I signed a consent form already. And out front they asked me to fill in a new patient form. I've been coming here 15 years.
Well, to be honest, we've temporarily misplaced your files.
You've lost it?
Well, no, we're sure it'll turn up eventually, but in order to give you the best care now, we need to update your history. We do that periodically anyway.
Okay. That seems reasonable.
Thank you. I see here in your form you're taking Vioxx. How long have you been on Vioxx?
Since the doctor prescribed it 2 years ago. It should all be right there in my file, if you could find it.
Yeah. Look, I'm not saying you failed to send the reports. I'm trying to explain that her file has been lost. I need to replace the reports on every test and surgery she's ever had there. I don't know what her number is. Yes, I know every patient gets a number, but since her file has been lost, I don't have the number. It is lost. We have to do it by name.
By now, Jackie has spent hours trying to duplicate Karen Adams' record. Unless the file turns up behind some cabinet, some of the data in it, such as the doctor's notes, can never be retrieved. And legally, if it is not in the file, it did not occur. So the loss of Mrs. Adams' file is not just a time-consuming embarrassment. It puts the entire practice at risk. Wherever you work, learn the filing procedures and follow them to the letter.